Hi, I am back again. Today's episode, I will be discussing the few diseases that I had along with lupus. Well, they, I don't know if, oh, yeah, along with lupus. The first one I'll talk to you about is pericarditis, which is inflammation around the lining of the heart. Um, the beginning stages when I was hospitalized a lot, maybe between the ages of 10 to, I'd say, 16, I was admitted quite frequently for severe chest pain. They eventually did some scans to see what the issue was that I kept on coming back and being admitted, and they saw that I had inflammation around the lining of my heart. And they saw that for the other organs, because of lupus, that's basically what it is. It affects the organs. There's no treatment for it, just was told to take painkillers, which I never did. Maybe once or twice, but I'm not fond of painkillers, because they can affect your liver. The next disease I'll talk to you about is hypothyroidism, which is what I have. There's hyper and then there's hypo, and I have hypo, and that is basically not enough thyroid hormone, and I have to take a drug called Synthroid to help with the thyroid. Again, in the early stages, I was always tired. They found out that's what I had. On Synthroid for 33 years, but different doses. It would fluctuate, but I'm on a good dose now. And that's basically the treatment. And if my thyroid level is out of whack, it could affect my brain and my heart. So that has to be monitored. I was doing it every year, but I've told my rheumatologist to, if we can just test it every 6 months, just to make sure that my level is good. I don't have to make any kind of changes. And he agreed. So far, my dose is okay. My level is okay too. And I think the next time I go back is in January to see how my thyroid level is doing. And the next one I will talk to you guys about, yes, I'm looking to my right because I wrote them down so I wouldn't forget, is hemolytic anemia. And that happens when the red blood cells, I wrote it down here, are demolished quicker than the bone marrow can produce new ones. Now, I don't know how I got this. I know I was told years ago. I was told a lot of information years ago. But that's what I have. And the doctors would give me a lot of, every so often, blood transfusions. And I had a lot of them when I was living in Montreal. And then I had an iron transfusion when I was in Toronto, but that didn't work well. And I believe it's because the drip was fast. There's a slow drip and then there's a fast drip. And that was my first time having an iron transfusion, was in Toronto. That was in June of 2017. And I had a severe reaction to the point that I was shaking a lot. And my brother-in-law had to come and pick me up. when I was okay, just to make sure, that I don't get on the bus and something happens. But after that, when I got home, I was fine. The next disease I'll talk about is thrombosis of the jugular vein, which is caused by a clot either like in the face or the neck. In my case, it happened in my neck. As you guys can see, I showed you guys in the last video. I thought I had a sore throat, but it turned out to be a huge clot in my neck to the point I couldn't breathe. And I remember my uncle coming to get me and bring me to the Children's Hospital in Montreal, which is on Tupper. I told you guys this in the last video. And they operated on me right away. And I had a tube in my throat for about a month to 2. And this is a scar that it left. I'm not sure if I had another clot after that, because later on they diagnosed me with deep vein thrombosis. And that is a blood disorder. And with that, you experience pain, swelling. Sometimes the area will be warm, or majority of the time it would be warm. And if you don't get it treated, it's a very serious blood disorder. If you don't get it treated, it can end up going to your lungs, and that's not pretty. It could really affect your lungs to the point that you have trouble breathing or even stop breathing. And it is it's just a very serious condition, blood disorder. And the treatment that I'm taking for that, I have to be on warfarin for the rest of my life. I do the doses myself. The doctor, I'll call him and tell him this is the dose I need, and he will write down or fax over the prescription to the pharmacy, and I'll go and pick it up. When I was living in Montreal, the nurses were doing the dosing, and then I'd go pick it up. But over here, for some reason, in BC where I am, I see a hematologist. We work together for a week. She sees how I do with giving myself my own doses, and she will monitor and she will look at the results when I go back in like maybe the next week. If she sees it's good, then she goes about her business. I continue doing my own business. So I don't prescribe it, the doctor does, but I tell him what dose I need, and I go from there. And I get that checked once a month, depending on how the result is. If the result is in the range between 2 and 3, that's my range, then I go back in the next month. If it's less than 2 or over 3, or even maybe like 2.7, 2.8, I don't like that range. It's too high for me. Even though it's supposed to be between 2 and 3, I'll go back in the next 3 weeks. My range, I like it at 2.5 in the middle. It's good for me. Now, the next one we will talk about is all the papers. Lupus itself. I have the systemic one, where it is dealing with your skin, your eyes, like your organs, basically. Your hair as well. I mean, I have a lot of hair, but this is easier for me to put in, like, extensions, because always busy on the go. So the one that I have, the systemic lupus, is the one where your body is attacking itself. like healthy tissues. And when it comes to the skin, I remember when I was first diagnosed, I had like a rash. It was like a butterfly rash. It was like a lot of, don't feel it now because it's gone, but it was on my face. My skin was very, very dry. I was prescribed a lot of different creams, seeing a lot of dermatologists. It's so long ago, I don't remember if any of the creams worked, but I have my own skin care routine that I use on a daily basis, and you can see my skin is nice and clear. But yes, and how they helped control and suppress the disease. At the time, they had me on a steroid called prednisone. I think I was on at least 25 of those small pills for a decade. I was on Imuran, and I was on Plaquenil. Now, the prednisone and the Imuran I was on for a decade. They stopped me, but I continued with the Plaquenil. And then June of this year, I was told to stop it because it was affecting my pupils in my eyes. And it's not that my pupils are still good. It's like an early stage, so they caught it at an early stage. Went and did like some kind of test. I had to go away to go and do that test, to see a specialist to do that test at a clinic. And I'm glad it wasn't a one-time thing because it wasn't pleasant. And I'm just waiting to get my results. So now that I'm off of the Plaquenil, I'm back on Imuran, which I'm not too fond of because of the side effects that it has. And I had a long conversation with my rheumatologist about this, and he was surprised at how much information I knew. But I mean, I don't know why he would be surprised, because 33 years I've been studying myself and trying to do better. So he has me on the lowest dose, which I appreciate, and he checks it every 6 weeks to make sure it does not affect my organs or give me anything else that I already have on top of the lupus, the hypothyroidism, the blood disorder, So he's good with that. And because my body has been going through this for 33 years, especially being on prednisone, that one of the side effects, it can damage your bones, osteoporosis, and easily have broken bones. I take calcium supplements. I've had a broken bone in the past, and it was my pinky toe. And luckily, when I went to go and see the doctor, they told me I didn't have to do any surgery. It's a small bone, it'll go back into place, and it did. That was years ago, when I used to work. And but yeah, currently I take calcium. I also take iron pill, 1 pill a day or every other day. I don't have any more blood transfusions except for last year, when I had that loss of blood in September. I think I forgot to tell you that with the blood disorder I have to stay clear from doing surgery. Because, I mean, anybody can have a clot when they do surgery, but in my case, because of the blood disorder that I have, if it's an absolute must for me to do surgery, then I have to stop the warfarin medication. They have to administer vitamin K through intravenous while they do surgery. That's how it works. And then I think in the next few days, maybe 4 or 5 days, I go back on my warfarin and everything should be back to normal. But they do have to check me on a regular basis if I had surgery to make sure there's no clotting anywhere. That's the scary part. And yes, back to the supplements. So yeah, I'm taking calcium because of the steroids I was on for about a decade. I take vitamin D3 because I don't go out often. You know, we need that in our body. And I take probiotics too, just for overall health. And that seems to be working fine because the past 4 weeks, the last 2 tests I had done, all my results came back perfect. And they've never come back perfect since I've been diagnosed. I think there was a time that it almost came back perfect, but that's when I went away, like, you know, to the Bahamas. But this time, like, it's just like, it's like I don't have anything. I don't have no condition. So I think I made the right choice with the supplements I'm taking, natural supplements, and still in remission, so I'm happy. And that's about it. Thank you for taking the time of listening to me today. And I will be back for episode 3 when, well, you have to wait and see. Take care.